Good morning and welcome to Pharmacology. We are going to go over chapters 6, 7, and 8 in this video. I'm going to give you what you need, okay? So in your pharm book, chapter 6 is all about sulfonamides. So these are antibiotics. As a matter of fact, all three of these chapters are antibiotics, and antibiotics are antibacterial. So these are drugs that fight against bacteria. They do nothing for viruses or molds or spores or fungi or other pathogens that can make people potentially ill. But they are used for bacterial infections. And antibiotics are either broad spectrum or narrow spectrum. The spectrum refers to, do they cover a whole lot of different kinds of bacteria, or are they very specific and the certain bacteria are the ones that they will attack? Sulfonamides are usually used with urinary tract infections. And in this chapter, we're going to cut to the chase because there are two meds that you need to know in chapter 6, and they are, mouthful, sulfamethoxazole, trimethoprim. It's a combination drug. That's trade names are Bactrim and Septra. And then the other one you need to know is sulfasalazine. So sulfa is right in the name of both of those meds, right? And believe it or not, there are many people out there that have allergies to sulfa. And so that being said, a person that's allergic to sulfa obviously would not be able to receive a sulfonamide, one of these drugs. So we would have to choose a different drug for that patient if they're allergic to sulfa drugs. When we talk about the sulfa drugs, sulfamethoxazole, trimethoprim, they control specifically those urinary tract infections caused by certain bacteria. E. coli is a common one. They have adverse effects like all medications do. Remember this, all antibiotics have the potential to cause gastrointestinal disturbances. Common, loss of appetite, nausea and vomiting, diarrhea, okay? And some of them can cause stomatitis, inflammation of the mouth. And this drug, this class of drugs can in fact cause that. And then three other things that you need to know. Urine and skin will start to turn an orange-yellow color when they're taking this drug. It is an expected adverse reaction. So in other words, you're going to tell your patient in advance, when you start taking this drug, you may see urine turn a yellow or orange color. Don't be concerned. Same with skin. When we're talking about the skin, photosensitivity. You're going to hear this word a lot. Photosensitivity and photophobia, which they're two different things. Photosensitivity means that your skin becomes sensitive to ultraviolet light, like the sun. So if you go out into the sun, you should wear a hat, wear sunscreen, etc., because you could be burned, okay? Photophobia is a little bit different. That is, just listen to the word phobia. That is where being in the light actually is painful in relationship to things like migraine headaches. We'll talk about that another time. Then the last thing you need to know is when a patient is on a sulfonamide, you need to make sure they're taking in a very good amount of fluid per day because they can develop something called crystal urea. So whenever you see urea at the end of a word, that means in the urine. So crystal urea is crystals in the urine, okay? And so they need to increase their fluid intake. Average adult human being should be taking in 2,500 to 3,000 milliliters of fluid a day. And that does not count things with caffeine in them. So in other words, caffeine is considered a natural diuretic. So it'll make the person urinate more, which defeats the purpose of the fluid intake. So they can have ginger ale because there's no caffeine in that. That counts as fluid, but not Pepsi or Coke because they have caffeine. Make sense? Okay. So you want to make sure that you understand what the hypersensitivity reactions, and these apply to all drugs. Pruritus is itching, urticaria is hives, okay? And then the other thing too with these drugs, hematologic changes, if they're on these drugs for a long time, sulfa drugs, they can develop thrombocytopenia, aplastic anemia, and leukopenia. This is on slide 7. What do those things mean? Thrombocytopenia. Thrombocytes are platelets. Platelets are things in your blood that contribute to the blood's ability to clot. So penia, that not enough. So thrombocytopenia means a decreased number of thrombocytes, decreased platelet count, increased risk for bleeding. Aplastic anemia, which basically means that you have low counts of red blood cells, white blood cells, and thrombocytes. And then leukopenia, referring to white blood cells. So number of white blood cells produced are decreased with prolonged sulfonamide therapy, which means the patient's going to be an increased risk for infection. So they need to report immediately if they have a sore throat or any signs and symptoms of infection, because their body's immune system is not going to have the ability to fight that off because of the decreased white blood cell count. And with all of these drugs, it's important to know, you read the nursing care plan or nursing implications in the F.A. Davis Nursing Drug Guide. Listen, the drugs that I've given you to look up, you want to go to your F.A. Davis Drug Guide, either the actual book or you can do it online. Go to Google, put the name of the medication in, followed by 2 simple words, nursing implications. So if you were looking up, say, sulfasalazine, nursing implications, and hit enter, Google is going to find you F.A. Davis PDF. So it's going to pull the page right out of the drug guide and give you the information that you need. Most of the questions you're going to get asked are going to be, what's your job as the nurse, right? So what do you have to teach the patient to be aware of? What are the contraindications for these drugs? So with sulfa drugs, if you know that they can cause thrombocytopenia with prolonged use, then the patient's at a risk for bleeding. So you as the nurse would instruct the patient. Report to the healthcare provider. Signs and symptoms of unexplained bruising. This be a sign of bleeding. Make sure they use a soft bristled toothbrush because their gums can bleed, etc., etc. All right, so that covers Chapter 6. We're going to move on now to Chapter 7. Chapter 7 is covering penicillins, cephalosporins, and then one other medication that you absolutely must know, and that's vancomycin. So the ones that you need to look up, the penicillin G, which is one particular type of penicillin. Penicillin, by the way, is the first antibiotic. And how was it discovered? Fun fact, moldy bread. True story, Google it. Anyway, so penicillin G, cephalosporins. Here's the way you can tell that a drug is a cephalosporin, because every one of them begins with the letters CEF or CEPH. Okay, cefepime, ceftriaxone, cephalaxin. Okay, and then last but not least is vancomycin. And vancomycin, I call it the queen mother of the antibiotics. It's the big gun, right? That's the one that we use when someone develops MRSA, methicillin-resistant Staphylococcus aureus. And one of the most important things you need to know about Vanco, when it's given intravenously, IV, the patient can develop an adverse effect called red man syndrome. And so if the IV is running in too quickly, Vanco's got to be run over at least 60 minutes. If it's run too quickly, the patient is going to suddenly start to literally turn red, flushed, warm, even hot. That means that it's running in too quickly. What do? Slow down the infusion, okay? All right, so as we go through the slideshow, some of the things that I've highlighted, which are the things that you definitely need to know. We're going to go down to drug resistance, which is slide 6. Drug resistance, and I know I talked about this in the infection video, but I'm going to talk about it again. With drug resistance, and it's typically antibiotics have to be used according to the directions. In other words, they have to be completed. So if it's 7 days of a therapy, you can't say, well, it's been 3 days, but I feel fine, so I'm just going to stop. Doesn't work. You can't use antibiotics if you have a virus, like a cold, right? Or the flu. These are viral infections. Antibiotics don't do anything for viruses. Adverse reactions on slide 7. Again, GI upset is one of the big ones, and the one you need to know specifically, pseudomembranous colitis. Pseudomembranous colitis is frequent watery stool, so diarrhea, sometimes tinged with mucus, sometimes tinged with a little bit of blood even, which can lead to C. diff. And what is that? Well, it's the antibiotic, and penicillin's kind of a broad spectrum, so it kills a whole lot of stuff. It's killing the bad bacteria in you, but it's also killing some of the good bacteria. So it throws off the natural balance that's in your digestive tract. When it does that, it can cause the pseudomembranous colitis that you need to call the doctor, right? Call the healthcare provider. Hypersensitivity reactions, of course. When we talk about, allergic reactions, penicillin's a big one. And don't forget this. If the patient is allergic to penicillin, the patient is allergic to cephalosporins. They have what's called a cross-sensitivity reaction. If you're allergic to one, you're allergic to the other. So if I can't give you penicillin, I can't give you ceftriaxone or cefepime or any of the cephalosporins. With penicillin, there's another fun adverse reaction, and it's called hairy tongue syndrome. Google image it. It is fun to look at, not fun for the patient. That their tongue will actually have an appearance that it's got kind of like fur on it, usually with more prolonged use. So you should know that. And then superinfections. A superinfection is an infection that it's like opportunistic. So you're taking an antibiotic, and the antibiotic, again, like I said, especially with the penicillins and the cephalosporins, they kill a whole lot of bacteria, bad and good. Throws off the balance, and then bacterial superinfections, but most commonly fungal superinfections. And the one you need to know about for sure is candidiasis. I say it like that so you don't forget it. Candidiasis is thrush. You can have oral thrush, which is white plaquey deposits in the mouth and tongue. Painful too, by the way. Or for women, you can have yeast infection, which is a vaginal form of candidiasis. So the patient would require an antifungal, either like a miconazole or something if they baking bread down there, or if it's oral, one drug. Oral candidiasis, nystatin, swish, and swallow. And we're going to get to nystatin when we get to the antifungals. But remember, oral candidiasis, nystatin, swish, and swallow. Don't forget that. And last but not least, and really important too, are hematopoietic changes. Hematopoietic means of the blood. And so hematopoietic changes are things like hemolytic anemia, which means to hemolyze something is kind of to destroy the blood. Hemolysis is destruction of red blood cells. So the person's red blood cells kind of get destroyed. And they become anemic. Agranulocytosis neutropenia. Now we're talking about white blood cells. Decrease in the production or the body's ability to produce white blood cells, which again will make that patient at risk for other infections. So that's stuff that you absolutely need to know. Slide 26 talks about nephrotoxicity. So whenever you hear toxicity and it's preceded by an organ or a body system, like nephro means of the kidneys, oto means of the ears, hepato means of the liver. Well, in this case, cephalosporins are considered nephrotoxic. In other words, they can be damaging to the kidneys. So one of the early signs would be a decreased amount of urine output. You want to make sure that the patient's educated about that and that you are aware. Moving through this slideshow, I would tell you to focus on slides 27 through the end. And those are slides that basically talk about what do you have to do if the patient has diarrhea? What are you doing? What are you doing to maintain the integrity of the mucous membranes, et cetera, et cetera. So slides 27 right through the end, make sure you look at those. All right. Now we're going to move on to chapter 8. Chapter 8 goes through tetracycline and the mycins, aminoglycosides, not Vanco, but some of the others. So first we'll talk about tetracycline. Tetracycline, the one thing that you have to remember about this, should never be given to pregnant women, lactating women, or children under the age of 9. Why? Well, one of the big things too with kids, it will actually discolor the child's teeth permanently. So they will have brown teeth, and nobody wants brown teeth. It's important for you to remember. So they are antibiotics, the tetracyclines, and they cover certain bacterial infections, as we talked about. But make sure you remember the brown tooth, okay? And tetracyclines, one more thing, do not take with dairy. All right, they should never be taken with dairy products. It inhibits the absorption. Okay, with the aminoglycosides, the mycins, again, another category of antibiotics, but really, really important. Nephrotoxicity, and I'm on slide number 9. Make sure you know this. Make sure you know this. Nephrotoxicity, damage to the kidneys. Ototoxicity, damage to hearing. And with ototoxicity, the first sign the patient is developing ototoxicity is something called tinnitus. Tinnitus is a spontaneous ringing or buzzing in the ears. They need to call the healthcare provider, stop the drug, because that can be irreversible damage. And then neurotoxicity is damage to the nervous system. So make sure that you know those things that I just discussed. This slideshow goes in a lot of detail with a lot of different nursing diagnoses. Pretty please with sugar on top. F.A. Davis is the place to go. Definitely take a look at slide 27, which talks about taking tetracycline on an empty stomach, full glass of water, and no dairy products, no antacids, that kind of stuff when they're on tetracycline. And slide 40, tetracyclines are usually the drug that will be given if the patient is allergic to penicillins or cephalosporins. So make sure you know that. And last but not least, slide 44 and 45 talk about dairy and calcium, so make sure that you know those things. All right, so that covers those 3 chapters. If you have questions, holla! All right, we're going to do 9, 10, 11, and 12, the next video. Peace, guys.